doctors don't suddenly become smarter in a crisis. They start thinking differently. Most people believe medical care fails during crises because of chaos, lack of resources, or panic. That sounds reasonable, but it misses the real shift that happens behind the scenes. In normal conditions, medicine is about optimization, comfort, precision, redundancy. In crisis situations, medicine becomes something else entirely. It becomes decision-making under constraint. When systems are stable, doctors rely on layers, protocols, equipment, specialists, backup plans. Those layers create a sense of safety not because every decision is perfect, but because mistakes can be absorbed. In a crisis, those layers disappear. And when they do, doctors don't follow the same rules anymore. At first, many try to. They reach for familiar protocols. They wait for confirmations. They assume support will arrive. That instinct makes sense. It's how medicine is trained. But very quickly, reality pushes back. Electricity becomes unreliable. Supplies run low. Information becomes incomplete. Time starts working against you. That's when frustration sets in, not panic, but friction. Doctors realize that doing everything right is no longer possible. So they shift to doing the right thing first. This is where most people misunderstand crisis medicine. From the outside, it looks like improvisation. From the inside, it's prioritization. The hidden structural change isn't a lack of skill. It's a change in what success means. In stable systems, success is accuracy. In crisis systems, success is survival through the next window of time. Doctors stop asking, what is the perfect treatment? They start asking, what decision buys us the most time with the least risk? Think of it like flying a plane. Under normal conditions, pilots optimize fuel, comfort, and efficiency. During an emergency, none of that matters. The only question becomes, what keeps the plane in the air right now? Medicine works the same way. In crisis situations, doctors simplify aggressively. They reduce options. They avoid interventions that create new problems. They become extremely cautious about anything that can't be reversed. This is where escalation of frustration often happens for patients and families. People expect action. They expect visible treatment. They expect certainty. Instead, they see waiting, monitoring, conservative decisions. That feels wrong, especially when stress is high. But underneath that restraint is a deeper logic. The real issue isn't that doctors stop caring. It's that they start protecting future options. Every decision in a crisis has a shadow. A medication can help or create a side effect you can't manage later. A procedure can solve one problem or cause another when resources are limited. Doctors become hyper-aware of second-order effects. That awareness changes everything. They rely more on observation. They focus on early warning signs instead of full diagnoses. They treat symptoms differently not because they don't know the cause, but because confirming the cause may not change the outcome. This is the turning point most people never see. The real issue isn't lack of care. It's lack of margin. When margin disappears, medicine becomes about avoiding irreversible mistakes. That's why doctors in crisis settings spend so much energy on recognition instead of intervention. Recognizing when something is about to become dangerous is often more valuable than treating it aggressively too soon. This perspective reduces blame. It explains why some treatments that seem basic suddenly become critical. Why expired medications are reconsidered. Why old techniques resurface. Why simple actions taken early matter more than complex ones taken late. Crisis medicine strips away comfort and exposes structure. It reveals that modern healthcare isn't just about technology, it's about timing, access, and decision hierarchy. And this is where the public often feels lost. People aren't taught how doctors think when systems fail. They're taught outcomes, not trade-offs. Understanding this difference doesn't turn someone into a doctor, but it does change how they interpret medical situations under stress. It helps them recognize when waiting is smart, when acting early matters, and when not making a move is actually the most responsible choice. There's no checklist for crisis medicine, no promise that preparation eliminates risk, but there is a way to understand the logic doctors use when the safety net disappears. If you want a structured breakdown of how medical decisions change under pressure, and how ordinary people can recognize critical moments before they escalate, there's a practical guide linked in the description. If this perspective helped you see medicine more clearly, consider subscribing. Clear thinking matters most when conditions aren't normal.